The problem that we're trying to solve today is how do you change diabetes from a disease where you're a victim and you're the culprit to one where you're empowered to take charge of your life, where it's less about being on the treadmill of, managing your disease every day, day in and day out, but about empowering you to not only take charge of your health, but also that of your family. So we want to make sure that the diabetic normal becomes the new normal. And the way we want to implement that change is by having diabetics in a family gain access to the health records of their entire family and look at those health records to be able to drive conversation, to drive change in behavior, knowing for a fact that the kind of behaviors we recommend for diabetics is actually good for everyone. More thoughtful eating, more exercise, less smoking, no smoking, and limited alcohol intake. And the mechanism, we also want to pick the right person within the family to do this. Hence, we looked at people who have both influence and control over what the family eats, and we want to target diabetic mothers. And we want to go to them with a program that allows them to know what the remaining typically 3 household members are doing through a wearable, a Fitbit-like wearable, and also give them monthly summary report of the output of that wearable, plus a quarterly report of the overall risk factors that they're facing. In order to implement something like this, there is a certain amount of investment needed to validate that this model actually can create change because it hasn't been tried in diabetes before. There's been some evidence to suggest that in bariatric surgeries, you have the family is losing weight while the patient is also losing weight. So we think it's a relevant approach. And we are looking at a spend of roughly about 1 crore over the course of 2 years and 500 households. So less than $10,000, less than $200 a household of spend, which is marginal for a new program intervention. And we want to use that to try this out and then partner with organizations for whom organizations for whom keeping people well is a model. Hence, first target would be insurance providers, and the second target would be people like Mera Doctor, who have a subscription-based prevention model. And that's the end of the pitch. Do you have any questions?
2.5 minutes. 2.5 minutes, yeah.